welcome, and many thanks to each of you for taking time out of your busy schedules to join us for this series, Finding Hope and Meaning Through Stories during the COVID-19 pandemic.
We're going to move on to our second round of questions, and Helen, I get to turn to you now. And you talked about how this has changed everything for you. Can you share with us a story that's come out of the pandemic that you'll never forget, that so moved you that it just will stick with you forever?
Thought a lot about this, and I don't really have a single story. The stories that we've been hearing are really harrowing. There is a certain repetitiveness to them, which is significant in itself. So we hear stories of healthcare workers who are soldiering on without proper equipment. We've got people dying alone, frightened, confused, their families excluded from their care. We've got stories of nursing homes ravaged by infections that are brought on by their own poor practices. We're hearing about great sacrifice, great heroism, but Dave, what I can't forget is how much of it was avoidable. There's a bright side, and it's not a cheery bright side. It's that the pandemic has exposed all the cracks in the healthcare system that we in patient safety have been trying to warn about for decades now. And it has made providers, I think, have a better understanding of what we've been talking about, because they are patients too now. They're seeing it up close, whereas before they were seeing little pieces of it. We've always said that medical error and infection didn't get much attention because they happened one at a time. Well, it's not one at a time anymore. So it's not stories, it's this huge tapestry, this huge canvas. And I think this is the moment to really push for change.
Thanks, Helen. And thanks for, kind of reminding us about the power of numbers. Crystal, I know that push, that outreach you're doing includes to some parts of the MedStar catchment area that are under-resourced, where there's really vulnerable populations. Do you want to say a little bit more about things you see especially happening there, the concerns of those caregivers who are treating people who are more at risk?
Yeah, Marty, that's a great point. And there are some of our entities who really have been hit hardest by the pandemic, or what we call the hot spots of the pandemic. And it's really hard to go in and see what they're facing. I'm a nurse, so for those of you that don't know, but I can tell you that I've never seen anything quite like this, the way that they're working and coming together and how it's really affecting them as clinicians and what they're up against. And quickly, I'll share with you a story that kind of sets the tone. One of the nurses was coming out of the break room, and she had a small suitcase, and I always try to, share little jokes, and I said, "Oh, traveling, I see." And she turned around and she looked at me and she's like, "Well, actually," she said, "my belongings are in here because I'm living in a shed right now because I live with my elderly mother, and I'm so afraid that I'm going to get her sick. So I bring my things with me to work, so that way when I'm done, I can shower and still stay on the property with her in case she needs groceries or any other type of care, that I'm able to provide it to her in real time." And you would think that that's just a one-off, but I promise you that it's not. It's a really hard-hit area, very underutilized. These folks are sick already with limited access, and COVID has just run rapid in their community, and we're seeing that impact in that entity specifically. It's really sad.
Thank you for sharing that story, Crystal.
Yes, thanks, Crystal. I echo Marty's words in saying you are definitely one of our healthcare heroes, and I'm always struck by how often tragedy breeds creativity. And the stories that you just shared really hit that home. Josh, I'm going to go to you next. And really, I know your COVID story still evolving, personal story, but is there anything specific that you'd like to share, as well as the creativity that's, this has really brought on in your world and what you're creating too? I'm really impressed to hear more about that.
Yeah, I do have a story. There's been lots of stories throughout my last 6.5 weeks, friends and other people who've helped me out. But there's one in particular. I was about 7 days from my first symptoms coming on, and COVID has this strange wave pattern where you think you're getting better and then your symptoms kind of fall off a cliff again. And that can happen many times. And about day 7, I'd had a couple of good days and then I had a pretty bad day. And it was the first time that I thought, I don't know if I'm short of breath. And that had been the guidance that was given to me, go in when you're short of breath, but you don't really know. My chest was very tight. I wasn't sure. I felt like I was getting dizzy. It was harder to get up and move around. And so I decided, well, I'm going to go into the ER, but I felt guilty about it. I felt like I might infect someone else. I'm putting burden on the system. I just felt really bad about it. And I also felt afraid, not knowing what they could actually do for me, because I read a lot of the media about there's not really much you can do, unless you go in and go on a ventilator. So I felt apprehensive, but this mix of really difficult emotions when I arrived in the ER. And I got there and I was talking to the triage nurse and she was going through and getting my information. And I stuck my hand out. She said, "Oh, put your hand out. Let me give you a patient wristband." And so I'm looking away. I've angled my body away and I stick my hand out for my patient wristband and I have my mask on and I'm looking down, trying to be responsible. And she kind of leans in a little bit just to put the wristband on. And she sort of whispers, "Don't breathe." And I kind of start back like, oh, maybe I did something wrong. And she winks at me. She also has a mask and she winks and she kind of chuckles like, isn't this silly that we have to do this? And there was this moment when I changed from kind of being a disease vector, feeling like that, to being a person, to being a person attended with another person. And that was immensely encouraging and meaningful as much as anything else in the ER.
Thanks so much for that, Josh. Those personal anecdotes really make the story come alive. There was a wonderful article in JAMA. They just did a medical humanities series. And Lori Aronson wrote an article about story as evidence, evidence as story. And what you just shared was how when you really come down to the moment with the patient, you don't need the data to prove the issue. So thanks, that's very touching. I think I'm going to pass this back to Marty now.
Tim, we're going to turn to you next and ask you to share a story that you'll never forget coming out of the pandemic.
Thanks, Marty. The story that comes to mind to me happened 2 nights ago. Every night we log into this kind of peer supporter training in Southern California with a huge group of people who join in. And during these trainings, we break into small groups. And the topic a couple nights ago was on this issue of moral injury, which I hadn't really read a lot about until recently, where moral injury is, it comes from, people being in the war and seeing things that are just morally reprehensible to them and having to try to move forward doing it. And it creates so much angst with that. It's kind of like what Dave talked about and Tracy, what you referred to, of what all of us are going through right now can be so depressing and so painful. But during one of these little sessions we did within the Zoom breakout room, hearing the nurses talk about, what they have to do to try to take care of patients is kind of mind-boggling, because they haven't been prepared to do this. And many of them did break down into tears because they don't have the kind of equipment, they don't have the things that they need. And their answers they're hearing from administration is, we don't have the finances to be able to do this. And it was just gut-wrenching to hear these different stories from what they're going through in the front line being able to do this. And I've never heard it to that extent before. I've never seen it on the faces of them about wanting to do so much more, but not being able to for their patients. And it's just so very painful.
Thanks for sharing that, Tim. I hadn't heard that kind of phenomenon happening as much, but it makes perfect sense that it is happening. Dave, I'm going to turn to you and ask you the same question. Of all the stories you're hearing, what is sticking with you? What will you never forget?
Marty, I think the thing that I've really enjoyed, what's really been memorable, the resilience of this country. This country, probably one of its strongest qualities has been its resilience through the years, finding a way to come through things and come through that stronger. The amount of love and attention and the people who have just stood up and are sending meals to hospitals, are giving money to support the caregivers. It's amazing. Kathy and I got an email today from the bank we use back in Maryland and said that they were donating $500,000, $50,000 to 10 Maryland hospitals of which 6 are MedStar hospitals, to help support the staff during these times and their families, not to give the money to the hospital, but to give it to the people who are doing the work and have the challenges at home. Crystal's seen these stories about nurses not being able to go home at night and be with their children and their husband, staying in separate quarters for like weeks at a time because they're afraid to come in and affect their families. That's where the love and support from so many organizations and people, the Gates Foundation, and just that's the thing that I take away is the resilience, people stepping it up.
Thanks, Dave. There is that whole inspiring set of stories out there too, and it's great to have you remind us of them.
Thanks, Marty, and thanks, Dave. I'm going to go to Vonda next. Speaking of resilience and driving across the country, I would really like to hear a story that's at the forefront of your mind during this time.
I'm going to try to merge 3 stories into one here. One and a birth that's coming up here, and I would typically be there, and it's just breaking my heart, and I know it's breaking my niece's heart that I won't be able to be there for that. A 16-year-old who was diagnosed at the beginning of the year with brain cancer that was near terminal, and the contrast of the brain surgery that took place just before COVID, when everybody around her was right by her side, to today having to get a lumbar puncture in preparation for her transition to chemotherapy for the next 6 months with just, one person by her side, and a very stressful time and situation, but with caregivers surrounding her to just really help her through that loneliness in her treatment plan. A person who desperately needs to have mental health addiction therapy and is scared to go into in-house treatment, and rightfully so, balancing that very difficult decision. And then the last one I'll say is, patient safety advocates like myself who have had direct experience are often hotlines for our families and friends and people, even friends of friends. I've received so many calls, but one comes to mind specifically of lung got punctured in the treatment of an emergency procedure. Person went home, friend of mine, woke up in the middle of the night, had to go back to the hospital. The hospital really did not have a plan in place other than to have the wife stay at the door. And for days, about 10 days, we navigated by phone. And I'll just conclude by saying that one of the stories that stands out for me is calling the Patient Safety Movement Foundation, Donna Processor, the chief medical officer. And within days, Marty was part of this, as several others were, we had an infographic ready to go out to both the caregivers and family members to support them in the distancing requirements that were now needed and to be put in place. And many people are using that infographic just today.
Vonda, thanks so much for mentioning that. What I've been so impressed with is the work that all of you are doing to address the needs of these specific vulnerable populations during this time, especially the needs of the patients and families who are isolated from their loved ones at a time of crisis. Thanks for sharing that. Pat, I'm going to turn to you and ask you the same question.
I'm going to talk about 2 stories because one is from a sort of a provider perspective, and then one is from a family perspective. And I'll start with the family perspective. I got a call from a person who didn't know who to turn to. He's got both of his parents are in what he thought was assisted living, but it turns out they're in a nursing home. And his mother has Alzheimer's, and his father has an advanced back injury where he can't stand. So they were in the nursing home, and right next to them, and this was early on in the pandemic, so we're talking the end of February, and the person next to them, the resident, ended up dying from COVID-19. Well, his mother started having difficulty breathing, and it was about that time that he couldn't make visits, but they were on the first floor of this nursing home, so he could tap in the window and he'd talk on the telephone with them, but his mother was experiencing great difficulty breathing. So they took her to the hospital, and at the hospital, they couldn't diagnose her. They didn't have the test kits at that time, so they sent her back to the nursing home. This went on 3 times. She went back and forth between the nursing home and the hospital. She ended up, yes, being diagnosed with COVID-19, but in between, she needed oxygen. And when she got back to the nursing home, they never had the oxygen. There was no coordination between the hospital and the nursing home. So her incidence of going back and forth could have been avoided. And so he talked to the administrator of the nursing home, he talked to the hospital, and they worked it out so that, yes, they finally got it resolved, and they both survived. The husband and wife survived COVID-19. Now, another one is a short story about dropping off the iPads at a nursing home. And this was a nursing home. The administrator met me outside. Of course, we had the gloves and the masks on. And I was giving her the iPads. And she said to me, you know, you have no idea what this means, how important this is, because the families cannot visit. And so it's been really very difficult for the patients, for the residents, and for the staff, because they're filling that void. And she said that they had no COVID-19 cases, but the fact is many of the nurses and nurses' aides didn't want to work at a nursing home because they had heard about all the incidents and the occurrences of COVID-19. So she had one nurse for every 34 residents. She never left the nursing home. The nurses and the nurses' aides stayed there. So when I work a lot with nursing homes, and there's many issues that need to be resolved, but I really believe transformation of nursing homes is upon all of us. We have the responsibility to take care of our seniors in their years when they need us most. And I think we have failed them. But I'm hoping that with this COVID-19, it has raised the awareness and we can move on and do great things to transform healthcare for our seniors, for those in nursing homes, or whatever type of settings.
Pat, you hit me right in the heart with that. I love the work that you're doing with the nursing homes. My grandmother was in one last summer, and I visited her there. It was in Dyersburg, Tennessee, small town. And I came home, alarm bells firing. I saw firsthand all the potential problems. And we lost her. She's 99. She lived a great life. We lost her in October, and I just am so grateful for her timing. It would be really tough not to be able to get to her now. The iPads that you delivered, I'm sure, are a godsend to so many. I know that dementia is getting worse because people are more isolated. Thank you. Marty, I'm going to toss it back to you.
And Pat, when you were speaking, it was just reminding me of what Helen said too about exposing all the cracks and all the gaps in our system. We've known about the problems in long-term care and the way we treat our elderly for a long time. And now hopefully we can't kick that can down the road anymore. It's just too obvious. Okay, Steve Burrows, I want to turn to you next. We've got a provocative question for you. Of all the stories that you're hearing and experiencing, what are you going to never forget?
I have my best friend in Wisconsin right now has a father in a nursing home, very much like the one my mom was in for 10 years. It's actually like literally 3 blocks away from where my mom was. And for the last several months, the family has not been able to see him. And about a month ago, the father gets COVID at this nursing home. This thing just like whips around like some crazy whirling dervish of disease in this thing. And 2 days ago, my buddy's father died, and they were not allowed to see him. They knew he was going. They tried, they're very strong advocates. They tried everything in the world to like talk their way in to see their father. It was a bad death. Not only the actual death, but for the family, they were not able to have any, it was horrible. They tried to do the iPhone thing. It didn't work. It was a disaster. And I kept thinking about, 3 months ago, my mother died, and I was very fortunate to actually hold her as she was dying. And I can't imagine the exact same situation for my mother, but I would not be able to like even get in the building, even to look her in the eye. This haunts me, what happened to my friend. The other thing I would say, a story that I am not able to forget here, and I will say mostly it comes from, I'm from Wisconsin, I live in California, but I have a disturbing amount of friends who are in complete denial of coronavirus. I mean, no masks, give me liberty or give me death kind of like talk. And I have tried for the last 2 months to inform this group of people in my family and my friends who are not stupid people here, who are just, it's more important for them to go to the bars. They want to go bowling. And I have been trying almost futilely to explain, like, how do you convince deniers that this is happening, that this is real? And this has been what I've been trying to do for the last 2 months, is trying to convince people, and I am failing with a certain segment. I wish I was more up, but that's kind of where we've been.
We can't all be up, Steve, on every question. I mean, there's a pandemic going on, and I'm grateful that you brought that sobering point back, because I've had those experiences too. I've had a nephew complain about how we're treating the doctors and nurses special, and this is a cancer survivor. I want to say to him, those people saved your life. You need to be more grateful, but he thinks it's a hoax. So that group is out there, and I'm glad you raised that. Margot, a story from you. What are you hearing? What are you seeing? What are you experiencing that you'll never forget?
Well, I was thinking earlier about the irony of this experience for the different perspectives of healthcare. Like, you have the people on the front line who are overworked, overwhelmed, putting their ass on the line every single day and just getting it kicked. And then you have the people, another group of people who I've been dealing with, they're losing their jobs, they're losing their health insurance. You have the people at the grocery store who are being called heroes and making minimum wage, and it's the inequity of all this is really striking to me. And I don't know the answers or how to correct it, but it seems that, I don't know, people, they're looking at different things, like they're looking at the healthcare workers who are getting laid off and saying, see, it's not that bad. Look, these people, I can't even go, get my mammogram right now or whatever. It just strikes me how unique this time is and how the different perspectives are getting more and more set in stone. And you have the people who, I have to go to the beach, and it just reminds me of, like, in World War II, if we'd all be speaking German now if we had that kind of attitude that a lot of people have now. So that's what I was contemplating.
Well, Margot, another sobering point, but a good reminder to all of us. And I thanks for bringing it home with that reminder of how we could do better to pull all together. Tracy, I'm going to put this back to you now for closing comments today, if you have any.
Thanks, Marty. I really appreciate it. And I'm so grateful that you all took the time to share your experiences and your stories today. I think we brought up a lot of interesting points, and I'm going to be eager to hear the playback to kind of see where we can take this and what we can build on, because my biggest takeaway lately, and from a lot of the things that many of you have said on this last question, is the needs of the vulnerable populations have only been magnified. And I think that's an understatement. And I'm wondering, and that's where question number 3 and 4 come in, is how are we going to change the future? How are we really going to do something? I mean, we're all reading, a group of us are reading The Plague right now by Albert Camus, and it's a playbook. Everything has played out according to his playbook written in 1957. So if we've known this, why haven't we, done anything different? Maybe that's a whole nother question for question number 5. Marty, did you want to comment back?
Well, I was just thinking about Camus at the same time, because of his messages, we're all a lot more vulnerable than we realize. And, that is part of as to quote Helen, the not so cheery silver lining here is we're reminded of our own mortality, our own vulnerability. It's striking to me that there are still people that are in denial about that, the points that Margot and Steve were raising.
Thank you all so much for participating in our Finding Hope and Meaning Through Stories during the COVID-19 pandemic series.